All right, so everybody, I'd like to introduce you to Rachel Garcia, who is a RN in Dermatology for Peace Health. And so I asked her to come, and she's writing a paper, but she's already written some of it, right? And this is from it, about the ever-growing concern of impaired healthcare workers. So, all you.
Thank you. So thanks for letting me come and be here. I initially did this for my bachelor's program, but I wanted to tailor it to MAs, and you guys are squeaky clean because I couldn't find anything. A couple DUIs, but mainly all my researching and gathering revolved around physicians and nurses who are chemically impaired on the job, or diverting medications.
Yeah.
So a little bit about me. I'm Rachel Garcia. I got my LPN and my RN at BTC, and then I went to Western and got my bachelor's. And I have 4 kids. 2 of them are my step. These are mine, and with me here. And for my bachelor's, I chose to pursue looking into chemically impaired health professionals because I had experience with it. And it was my mentor, the person that made me go, I want to be a nurse. This is why, this is what I want to do. And it got so bad to the point where she would be calling in prescriptions under my name. So it made me angry, it made me upset, but it also just completely blew my mind that she's the one that you would want when there was someone crashing. She's the one you'd call. She knew everything and she was on it. And thankfully she's doing much better now. But it just made me think, how many more are out there? And the problem and the public safety risk that's out there. So some stats and facts. In the U.S., it's estimated that 103,000 healthcare professionals are working chemically impaired. That's what we can estimate. So there's a whole bunch more. 1 in 10 will have a substance abuse problem before the end of their career. And I'm not just talking about nurses, this is physicians, these are pharmacists, and it is something that sadly is either they're ridiculed and kind of pushed out, or they're just kind of let go without any repercussions, so then they move on to the next facility. So it's a revolving door of liability. So I did, like I said, I tailored this towards nurses, but I think because you guys work with nurses and physicians, this is going to be beneficial because it's going to give you a little bit more insight, and if you already know about it, I think it'll add more information you can use, keep in your back pocket. So, but in 2013, Washington had 854 healthcare professionals in a drug monitoring program. 531 of them were nurses, just nurses. And 67 to 90% of all nursing board disciplinary actions have to do with substance abuse issues. And one of the reasons they think that is with nursing is they've also done a lot of behavioral background checking, and they found a lot of them, I think it was around 67% had child trauma, and a lot of them were codependent behaviors. So when they go into a job like nursing or working like you guys do, we see people on the worst times of their life. We're emotionally, physically, spiritually drained, and so people who don't have really good coping skills are going to turn to something. And for nurses, having drugs readily available to them is a quick. So the areas that the highest stress level they found where nurses were diverting and physicians were the ER, the ICU, OR, and skilled nursing facilities. And I think you guys can all relate to this when you've had totally crazy day, you're understaffed, lots of high demand, maybe not so much support from the upper management. I don't have that problem, but those are key factors in how it's going to affect you and your coping skills. And for, like I said, for nurses and physicians, and even for you, that these are high-risk areas, and even if it isn't in there, it could happen in your office. Okay, so These are just short, quick little videos. That I thought would be helpful just to see. I don't know how to work the sound.
Homesick addiction.
It occurred to me one day when I was working in an emergency room that we throw away a lot of awfully good drugs, and I should take them.
Kristen Waite-Lavitt is a confessed real-life nurse Jackie, and she makes this astonishing admission.
I was putting my patients at residence.
Catherine Cowart was a warm, thoughtful nurse who brought flowers to her patients' homes. But cops say she also helped herself to their pain meds. Just listen to her explanation during this police interrogation.
It is, yeah.
And I'll tell you, it is not normal for someone to go in somebody else's house and eat their pain medications.
I don't know what to say.
Our Milwaukee affiliate, WITI, launched an investigation into nurses stealing drugs. They uncovered court documents revealing allegations of one nurse actually taking pills from her cancer patients even after they died. This nurse, Stephanie Jones, is accused of removing morphine from syringes and refilling the syringes with water. State discipline records from the Department of Safety and Professional Services reveal 42 patients were affected, and Jones allegedly did all of her dirty work without wearing gloves. Those same records show 5 of her patients got bacterial infections, and tragically, 1 died. Stephanie Jones had her medical license revoked, and WITI reports Jones told investigators the drugs were an escape from troubles in her life. That's one of the same reasons Kristen Waite-Lavitt says she stole drugs.
Nobody knew that I was using until, they caught me stealing.
Kristen says her marriage was on the rocks when she started using on the job. She was eventually caught, went to jail, and now has this terrifying warning.
I think this is a huge problem, and I don't think there's a lot being done about it. Everything's very hush-hush. Nobody wants to talk about it.
A number of Milwaukee hospitals refused to comment, but the Wisconsin Hospital Association maintains there are a lot of good nurses out there.
Patient safety has always got to be first and foremost.
Stephen Rush is also a nurse. He's quick to point out drug abuse among nurses is on par with abuse of prescription pain meds and opiates in the population at large.
That's a widely held myth, that nurses are disproportionately more affected by this issue than the general population. And that's just simply not true.
But during the last 2 years in Wisconsin alone, 104 nurses have been disciplined for drug diversion or related crimes. Hospitals are trying to crack down. Some are even going high-tech, requiring a fingerprint before any staff member can access narcotics.
Every action leaves what we call an electronic footprint.
Despite the increased monitoring, the problem continues. In hospitals, in nursing homes, even in patients' own homes. Kristen claims it's a way to cope with a job that deals with life and death.
I was always so nervous and so uptight that it just helped me to feel better. It just made me feel better.
Now 10 years sober, Kristen has written a book, An Unlikely Addict. Her message, before you help your patient.
Okay, so sorry for the lady's really dramatic voice, but throughout that thing, but as you can see, I mean, it happens all the time, and the sad thing is our patients are going to be affected hugely. And one of the things I found when I was digging through all the information was that, like I said, there's a current trend of denial, and all too common with many healthcare institutions, claiming they are not responsible for the addiction problems with their staff. But they can affect how they're staffing, how the hours, the patient load, affects her, who is to help manage the stress. So I also found that for all healthcare professionals, only 1 out of 5 would report someone they suspected. So, I mean, can you imagine coming on shift and you're at the doctor's office and your doctor comes in but you're smelling alcohol? Would you really confront him? I mean, it's a tough thing. You could be wrong, or no one wants to feel like the snitch is what a lot of these nurses said, like, so they turn the other cheek, or they're in denial about it themselves. So let me get out of here. There's just one more and it's pretty short. But I think this will be a little bit more closer to home because it does feature a physician and how easily he was able to not.
See what would happen.
All it took was one time for me to be addicted.
At the end of that time, I was taking about 500 milligrams of opiate narcotics.
Looking back, there was nothing about my day that was safe.
I worked impaired every day for over a year and a half.
It's amazing to me that I was not caught.
At that moment, I had basically just given up all hope, and I just thought that I would overdose and somebody would find me or I would die.
Healthcare workers addicted to prescription drugs. It's an issue impacting more than 100,000 doctors, nurses, and other medical professionals each and every year across the country.
I spent 9 months active in my disease, and nobody suspected anything.
Anita Bertrand is part of that statistic. As a nurse anesthesiologist in Houston, Anita had no history of drug use before she got hooked on pain medication following an abdominal surgery.
People's lives were in my hands. I put this person to sleep. They're asleep and having surgery. And I'm thinking about, when can I get some more narcotic?
Before she knew it, Anita had resorted to drug diversion, the official term for stealing drugs. It got so bad, Anita even put an intravenous port into her ankle to inject drugs more efficiently.
Addiction to opiate narcotics really sucked the life out of me in every aspect of my life. In the morning when I got out of bed, I felt like an 80-year-old man. I was in my early and mid-30s, and literally it hurt every step that I took.
Stephen Lloyd turned to prescription painkillers to deal with stress during his residency. By the time he was practicing internal medicine, he was gobbling up to 100 pain pills a day, Percocet, Vicodin, whatever he could get his hands on.
The risks that I took every day were scary for me to think about today because it was with my patients. And in a lot of ways it doesn't even seem real, but it was. And it was only because of the real competency of the folks that I worked with that something bad didn't happen.
Not everyone is so lucky. Laura Lolani went into a Denver hospital for routine kidney stone surgery, but within weeks, she started developing strange symptoms.
Really fatigued, very tired, definitely some nausea, and I just thought maybe I was working too hard.
A series of blood tests and scans led to a scary diagnosis.
As he was telling me protocol and what I should do, I read the words hepatitis, and my heart sunk.
But the worst news was yet to come. News broke that a surgical tech that was part of the team that operated on Lauren was caught diverting drugs.
So basically, she was taking syringes that were full of fentanyl, a painkiller. She was injecting herself. She had hepatitis C, and then refilling them with saline and putting them back on surgical trays. So not only, did I not have the pain medication that I needed, I also had hepatitis C.
USA Today reviewed thousands of government records and found that effective safeguards to detect and prevent drug use are rarely employed in healthcare facilities. In fact, no state has universal drug testing requirements. And if offenders are caught, disciplinary action is rare. Often staffers are simply turned loose to find new jobs without treatment or supervision. The University of Tennessee Medical Center decided to tackle drug diversion and placed Kimberly New in charge of controlled substance surveillance.
We initially identified more than one healthcare provider per month that was diverting within the facility.
New says it's a practice that happens much more often than people realize.
Any healthcare facility that handles controlled substances will have diversion going on.
News says drug diversion is both an addiction treatment issue and a law enforcement issue. She says it places patients in danger and is a felony in every state. But at the same time, those drug-addicted healthcare providers need access to rehabilitation so they can return to safe practice.
A couple of things that I think are very important include reporting standards that require institutions to report drug diversion to regulatory authorities and law enforcement. In addition, having some type of immunity provisions for healthcare facilities so that they can openly give references relating to drug diversion issues and other patient safety events.